Well, welcome back to More About Birth. We're really excited to have the second half with some special guests with great stories. So Shannon, introduce your guests.
I would love to. I'm so excited. We have the privilege of continuing our podcasting with Dr. Mundall and his wife, Eloise. And when we met with them before, with the first podcast, we heard awesome stories about their history, their background, some things they've been involved in. And with this podcast, we'd like to kind of pick your brain a little bit about kind of the medical side of things and some of the exciting, maybe even bizarre situations you've encountered with pregnancy, birth, postpartum, newborns. So Angie, what do you want to start with?
Well, just any birth stories, tips, some of the crazy things that have happened. And also I want to hear a little bit about what it was like, I don't know, the political climate or just what it was like being an MD and doing out of hospital births, because that's pretty rare. I'm sure it was, even more rare today than it was then, but I think even then it was probably not the norm. So just what that was like navigating that.
Well, after we went to Minnesota, I came to a town called Bertha, 512 population.
All right.
16-bed hospital, and I was the only active staff at the hospital.
What?
So I had my own hospital.
Wow. Wow.
And, which means I was on call, of course, 24/7.
Yeah.
And that's just the way life went, and I actually enjoyed it. One time the hospital staff came to me and says, we want you to be the hospital administrator. I says, no, I'm sorry. That's where I draw the line. I said, I'm a doctor. I said,
I'm already the doctor, the nurse, admin.
But anyway, they did find an administrator that worked well. So it was just an enjoyable experience all the way around. This area had a lot of old order Amish folk around. In fact, our next door neighbors were old order Amish. And they were pretty well accustomed to home deliveries as far as that's concerned. So that was where a lot of the population of that came from. They were very simple in their lifestyle. For those who don't know, they don't use motorized vehicles. They don't have electricity in their homes.
No telephones.
No. So it's all very, and of course, this is long before the era of cell phones too, but it was a very simplistic life. Most of them walk a lot and they stay in good physical shape. So that makes their deliveries usually go pretty well. So in fact, one of the classics was a lady who sent out a message telling me she was in labor and she wanted me to come to the house for the delivery. So I prepared my little satchel I had 2 medical bags. One was just the delivery equipment and so forth. So I prepared that, went out to the house, got there and walked into the room. And she says, will you tell me when you're ready? So I put on my gloves and I put a little sterile drape underneath her in the bed and said, okay, I'm ready. And she gave one push.
No.
And out popped a full-term baby, probably 7.5 pounds, whatever.
Wow.
Breech.
Oh.
And just one push, and here was this breech baby in my hands.
Whenever you're ready. So you only had 2 bags. We carry half the house with us. It's ridiculous.
Yeah.
We'll have to find out sometime what you carried in those bags.
Right.
Not lots, but anyway, I did have a little Doppler, so I could listen to heart tones. And I had, of course, for my prenatal, I did use calipers. I measured calipers and tape both ways always to see how much growth there had been for the uterine size. And I could pretty well, I assessed the gestational age that way. I only used ultrasound, I think, once or twice in that 5 years.
In all the years?
Yeah.
Wow.
And never missed recognizing twins when they were present. So it was an enjoyable time.
Sometimes I think in our modern age, we've lost that skill of like touching and palpating and estimating gestational age and just kind of telling what's going on in mom's body by what she tells us and by what we see, because we're so reliant on modern technology.
Yeah, it gets to be over-relied upon nowadays, unfortunately.
Yeah. I bet you have lots of fun stories.
Yeah. Yeah.
So do tell.
Okay. There's another one. We had one of those Amish expecting twins, primate. Well, he didn't like to deliver primip in the house. He
Which is a
just-
first-time mama, if you don't know.
Oh, yeah. I'm sorry. I should have said that.
Medical speak.
Yeah. She never had a baby before. Well, it was going to be twins, and he wanted to deliver in the hospital. Oh, no. She wanted home. No. So, they have to send somebody to a neighbor's to call on the phone.
Yeah.
So early one morning, husband calls, she's in labor. And John goes out with his car to the house, and he wanted to take her to the hospital in his car because they don't have a car.
Mm-hmm.
Well, she didn't want to go. And I thought, he's over there trying to talk this woman into going to the hospital. And there's no phone to tell the hospital she's on the way.
Right.
I think I should call the hospital and tell them she might come. Later, the head nurse said, I'm so glad you called. 10 minutes later, she pops up having twins. And I'm glad we had 10 minutes warning.
Wow.
And
Barely made it.
all went well. Another time we got a call from Amish having a baby. And it was 26 below zero that night. And of course, snow all over everything. And John wasn't feeling good that night.
Wow.
So we head out in our little orange Saab and ran into a snowbank.
Oh,
Oh no.
Slid.
like stuck?
And we always had a shovel with us, except that night. I don't know what happened. Took it out, I forgot to put it back in. So we had a friend with us that was temporary help for a few months living with us. And John wasn't feeling good. So the two of us got out with our hands and dug that little car out.
Oh my.
And we got there in time for the birth.
With ice cold hands.
Yeah.
We had gloves. I don't remember that. We were kind of panicked. But, the rural medicine is a little different
Yeah.
going into those homes.
Right.
And then you didn't know what could happen in the hospital. One time, even then, we had a Primip 19. And her husband was there with her. She had not had a class. So I was labor coaching her all through. And so the labor went, as long as I stay with her, it went well. Well, the baby was born just fine. And the placenta came. And with it, a basin full of blood.
Uh-oh.
Don't expect that on a Primip. It's just the nurse and I and John. And the husband standing there who didn't have any medical training. Good thing. So he wasn't worried. So I took the blood pressure just like it was normal. And I calmly said to the doctor, blood pressure 70/30.
Uh-oh.
And husband didn't mean a thing to him,
Yeah,
fortunately.
right.
So he wasn't panicked. And my husband ripped off his gloves so fast, he said to the nurse, hand me the IV equipment. He knew he didn't have much time.
Goodness.
And we had to give her eventually a transfusion. But we pulled her through. She had little problems initially, but she came through okay. The husband later said he thought that was our routine.
You know,
he didn't know there
wow.
had been any
I
emergency.
see that a lot after the fact. You talk about it, and
Yeah,
nobody
told
else
him.
in the room had a clue that anything was
As
wrong.
long as you don't have.
Right.
No,
good.
and you don't want to let the people know there's a problem. You don't want any
Right.
panic in
Yep,
the
you
room.
have to just smile and
But that's what I've
working.
learned about deliveries. You don't know what can happen. Going in the
Yeah.
snowbank or a basin full of blood, you don't know
Right.
what will happen.
Right.
So in a rural community, did you have times where you did have to call an ambulance when you were doing a home birth? Is there a story you
Or
can
was there
think
not
of?
an ambulance?
Yeah, did you not
And where
have
would the
that?
ambulance go?
Right, and
Yeah.
where would they take them?
Yeah, this is, well, there was another doctor, sole practice himself, Dr. Brown, down about 25 miles away. He had his own hospital. So I could, if I needed, refer someone down there. One time, I don't know if it was that particular incident or whatever, I picked up the phone and called him just to get some, information and back up and see what can, he says, you got a baby, you just got to deliver it. You catch it, you do what you got to do, keep on doing what you're doing, too late to do anything else. So that's the way it was. But I always like to keep things simple and natural. I didn't use fetal monitors. I didn't want them. I didn't use IV routinely, only when we need it like that.
You sound like a midwife.
Because, because the woman's a lot more comfortable without all the
Yeah.
needles and straps and everything else. And I think it really hampers good labor when she's got all these other pain-producing
Yeah.
devices.
Mm.
Yeah.
So, in however many years of deliveries in Minnesota and working in that, under those conditions, so was there not one C-section in all that time?
Oh, yes, I'll tell this part. There definitely were C-sections. He had maybe a 5% rate, you'd say?
I had actually a 2.5% C-section.
Wow. 2.5% rate.
Awesome.
But
Way
you
to go.
But you didn't know when you were going to have a C-section.
Right.
But he had arranged for, it wasn't just babies he did. He did all the emergencies, farm accidents, surgeries.
We did surgeries there in the hospital, appendectomies and different other surgeries. Yeah.
So he had a surgeon come in from 80 miles away from another hospital, and he brought his own anesthetist with him. And our surgeries were scheduled for Wednesday morning.
So don't have a C-section any other day than Wednesday, right?
But we didn't know when we'd have a C-section because
Right.
they weren't planned. But without fail, every time we found we had to do a C-section, they came in on labor and Wednesday morning, and we did them
That
first.
was a God thing.
That was a God thing. And God takes care of the people, doesn't
That's
he?
so cool.
That's
When
amazing.
John's a praying doctor, and he prayed for his patients, and it all went well. The other thing, if we had a problem like a preemie coming, Minneapolis, which was 3 hours away, they'd set up an ambulance with a staff,
Mm-hmm.
a NICU ambulance. And you knew the one labor, and it would be born early, and they would take it back with a whole team. And one time we had twins that were early, and they sent 2 NICU ambulances up,
Wow.
which was very good service.
Wow. Wow.
One was a lady who was a little indiscreet in my viewpoint, about 6 months along she was, and she ate a big heavy meal and then finished it off with something to chill the food. I forget, it was ice cream or something. Anyway, it was just too much overload. And I have a theory in pregnancy that a woman's body says, I'm growing a baby, that takes a lot of work.
Yeah.
And if you give me a heavy meal to digest at the same time, I have to pick which I'm going to do because I can't do both very well. So if she eats a really heavy, hard to digest meal late at night when her body's tired, that can precipitate premature labor. And that's what happened in this case. And she went into labor and delivered these babies way early. But since we knew she was in labor, we did call, and they got a crew, and babies made it. I think that one went to North Dakota, if I recall, but one of them anyway. But anyway, they did survive, but it's too bad in my view that she hadn't been more aware of how she could have kept them.
Yeah, nutrition and just the way that you eat
Yep.
makes all the difference. I think it's time to go to a
Wow.
break, but when we get back, let's talk about that some more. That's a great topic.
Sounds good.
We'll be back in a minute.
Well, that's the first half of today's More About Birth episode with the Mundalls. It's good to have them back. We will be back with more with the Mundalls after the break. Well, welcome back to the second half of today's part 2 episode with Dr. Mundall and his wife, and Angie Henson. You are going to lead the ship here in the second half, so take it away.
All right. So I think you guys have a couple more stories for us. I really want to hear about how you dealt with the eruptions that you encountered and maybe the food allergy story, because I thought that one was fascinating.
Yeah.
That was a long time ago, but in 1 week, he had 2 abruptional placentas, women, and he could not do a fast C-section. And thankfully to God, he pulled both the babies out, saved both mothers, and he never lost a baby that was alive when the mother went in labor, or a mother. And I think that is a blessing of God, and we're just thankful
yes.
for that.
This was in the hospital.
That was in
happened.
the hospital that happened. Both of those were in the hospital. But still, all you could do is deliver the baby. You're 25 minutes away from doing a fast
Right,
C-section
right.
somewhere else. So,
Yeah.
God blesses when you are out by yourself. You do the best you can.
Now, when you say pulled the baby out, I mean, what does that
Yeah,
mean?
explain this.
How
Well-
far were these babies along? And, just like from a midwife medical standpoint, like what did that look like? What did you do?
She wants the details.
What did you do with your hands? Like, how did you accomplish this?
Did you literally pull them out?
Well, what you need, of course, if you have the head in the birth canal and it's blotting the cervix, then you can't bleed much from that, but you can still bleed behind the baby.
Right.
And so that's what happened with the one is didn't really have much awareness until all of a sudden the baby's head delivers. And then when you get more space, all of a sudden the blood starts gushing out and you're like, oh, that's what was going on. So at that point, then you just have to deal with the baby and make sure it's...
So you literally reached up there. Did you reach up under the arm?
Fortunately, I have
Did you...
small hands. Yeah, and I'm familiar with the Marisol manure if I need it for breeches. And, you know, I learned heard of a couple tricks I've never had to use, but I was prepared anytime. If there was ever, in my internship, there was once a baby that was a diabetic mother, and the baby was probably, I forget, 12 pounds or whatever. It was a huge baby.
Little one, yeah.
Basically, they had delivered and couldn't deliver beyond that, and that baby died. And I was not the delivering doctor. I was just, you know, an intern, and this was another resident doing the delivery.
Wow.
But I wanted to learn how would I ever prevent that if it were my delivery. And so I learned about, you know, reaching your finger in and snapping the clavicle and making the shoulder smaller so you can get the shoulders out. So I never fortunately had to use that maneuver for shoulder dystocia, but I had it in mind. The other one that I learned about, and I fortunately never had to use, I heard it came from midwives in Africa, and you have to have the right equipment and the right knowledge. Unfortunately, I never had to do it there, but they have a little, almost like a utility knife, but a certain blade, a certain length. And if you got a dystocia where you just can't deliver that baby and there's no chance for a C-section, you take that knife and you just cut the symphysis pubis.
Just separate it.
Just separate it.
I've heard about that.
Yeah, and then you can deliver the baby. And, you know, maybe not be the most wonderful way to do it, but it's better to have a live baby than not. And the women that have had that done, even though the pubic bones stay apart afterwards, usually you could sew them back together, but usually it's not done. They say there's no real problem. They don't have any difficulty with dating afterwards. It's not a big...
Well, I think some pubic bones actually separate on their own.
Sometimes the ligaments are soft
labor.
enough.
Yeah. So I want to hear about this allergy story.
Yeah, that was an interesting lady. She already knew, of course, she had allergies. She had a lot of hay fever and so forth. And in that time frame, I had learned about a blood test you can do that measures the levels of the antibodies in the bloodstream towards the proteins from certain foods. Yeah, back in that day, it was called
the N95?
RAS testing, radial large absorbent procedure. Now it's called ELISA testing because it uses enzyme-linked immunoassay. But anyway, I had that test available. This lady had a lot of allergies. When she first came to me, she must have been, I think, second or third month of her pregnancy. We did that blood test, sent it off to the lab, got back the results when she was 4 months along. When she came in that time and I measured her, her uterus was 7 months size.
Wow.
At 4 months.
And you'd probably think twins,
You think twins, the first thing you want to think of. And I listened and couldn't find a second heartbeat. And I was usually pretty adept at that. If there were two, I could usually feel the fetal parts or find that second heartbeat, and I couldn't. So anyway, she started on the diet right at that point. We found out which food she was allergic to. She stopped eating those foods. She came back a month later at 5 months. Uterus was 5 months size.
Wow. Do you think it was excess fluid?
So yes, I recognized then this was a case of polyhydramnios.
Yeah.
There's just all kinds of amniotic fluid in there. And that's one of the consequences of immune system reactivity when we have allergies. That's why people get more congestion in their sinuses or wherever else to make more swelling.
I never thought to relate it.
So it caused swelling in the amniotic fluid. And so as I've said many times, every one of my patients is one of my professors. I learned from everyone, and she taught me how important addressing the immune system is. Yeah.
I feel like I've learned and learned and learned, but the more I learn, the more I realize I don't know. The more I need to learn.
Right. Yeah. It's infinity beyond. There's always something new. Yeah.
Interesting.
Yeah,
so which
isn't that
allergy
amazing?
test are you using currently?
The one I was using at that time, I'm not sure if it was Immunolab. It wasn't Immunolab in Florida. I think there was one in Kansas City, but
so you're sending them off.
I send it off.
Local.
I don't have it. I can't do it in my own lab. No, in the standard laboratories don't do that kind of testing.
Right.
It's got to be a specialty lab. The one I've used most in this region is US Biotech. It's in Seattle, and they do a good job and for quite a reasonable price. There are labs back in Florida that sometimes charge as much as 10 times as higher price.
Okay.
Wow.
So
I'll have to get that information from you later.
Wow.
But this is probably a good time to talk about how you even know these great people and where they're located. And
Well, that's a whole other story unto itself as far as how they got to Connell.
5 minutes, right?
Yeah, and the practice that's there. But we actually found these guys about 10 years ago. I had a good experience previously with an integrative medicine doctor, and so had looked up a doctor in the Tri-Cities area that way and found them, and we're so thankful that we did, because it's just been an incredible experience. I can't say enough good things about the clinic and about the Mundalls and about their practice. And it's just very unique, very personal, very old school in the good sense of the personal relationship, and the willingness to go above and beyond for people is just incredible. So, tell us a little bit about your current practice and what it looks like in your specialty and what you're doing these days.
Well, over time, when I was in medical school, I sort of made a vow to myself and my future patients. And I said, I'm going to pursue truth about health the rest of my career. And I really don't care where I end up, which is a pretty bold idea to have. And this is where I've ended up. And it's been a long, winding pathway. And it wasn't too long until I was diverging from what I had been taught. I learned in medical school about different tests that some people did, including this blood test for allergies, and was told that it wasn't worth the paper it was written on. So I had that bias to overcome to ever start doing that kind of testing. Another test I heard about was a test for checking the minerals in a person's body, both good and bad. What's their calcium level and their lead level or their cadmium level, whatever. Right. Using tissue instead of using blood. Turns out that many minerals don't have very adequate levels in the bloodstream, that they're not water soluble, and so they don't stay there, they travel to the tissues. So there's a test back in that era that I used a lot and still use some, and uses a sample of scalp hair. And we can measure the minerals with that and get some idea of whether the body has a deficiency in, say, a trace mineral like manganese or boron, or whether there's an excessive body burden of lead or cadmium or aluminum or whatever. So I was also told that test in medical school was not anything to be desired, and it was a waste of patients' money.
You're just a rebel.
Yeah.
Probably a little bit of that somewhere. So anyway, when I got out into practice, especially in Minnesota, I had my knowledge that I had gained in medical school. I said, I'll try to do everything by the book. So I did just the way it worked. Was supposed to do it. Didn't work for some patients. Yeah. I did what was right, and it didn't help. I said, okay, if I did already the things I'm supposed to do, use the drugs I'm supposed to, or whatever else I was supposed to do, and it didn't work, then what have I got to lose by looking some other directions and finding some more answers? So I started doing that, and lo and behold, I found answers, and it was really interesting to me. I recall one case was when I was practicing in western Nebraska. A lady came in, and she was feeling sick, headaches and dizziness and fatigue and so forth. I did a hair sample, sent it to the lab, came back. She had an excessive body burden of arsenic. Oh. And so when she came back for the visit, I said, well, you're arsenic loaded. She says, yeah, I figured it was some toxin. She says, we were living at a certain farm, and I was getting sick there, and we already moved to another farm, and I'm already starting to feel better. So apparently it was in the water in that well at that farm. But without doing that test of a hair sample, I would have never had a clue as to why she had been sick.
Do you do saliva testing at all?
I do some saliva testing. Mostly nowadays for hormones in some cases and things like that.
So what would you say is your specialty if someone were to say, go to Dr. Mundall because he's just really honed in this particular area?
Well, it's hard to use a single word, although integrated medicine comes pretty close, I suppose, or whatever. But I, fortunately, early in my career, took a couple classes from Jonathan Wright and Alan Gaby. And they had a class they called nutritional medicine. And I took that course. It was a several day course, and they would go through every nutrient and say, okay, this is what it does. This is what you feel like if you don't have enough, this is what you have, you get too much or whatever. Then they'd go through every disease and say, from the medical literature, what did that disease would respond to in terms of nutrition? So it was quite a complete thing. And obviously nutrition doesn't fix everything, but it does work with many conditions. So I oftentimes do term myself a nutritional MD. But as I got more into that, I realized there's multiple areas of health that are being affected by our modern society with the environment we live in, and especially toxins is a very important one because of all the pesticides and heavy metals and things that are out there. So I took classes on how to get rid of toxic metals and so forth from the human body. And the main process we use there is called chelation therapy. So I learned about that and began utilizing that. And so That area I call clinical toxicology. We're looking for what's poisoning the body and try to
Mhm.
clear that out. And then the nutritional medicine, we find what the body doesn't have enough of and correct that. And then the third area is the immune system. If our immune system is fighting the wrong things or not fighting hard enough, then that creates problems. And that's where the food allergies come into it. So those are the three main areas that I practice in: clinical toxicology, nutritional medicine, and immunology or food allergies.
So when someone comes into you just for a general problem,
Mm-hmm.
you look at the whole picture.
Absolutely.
You don't just say, okay, here's a prescription for whatever symptom you're having.
No, if they're looking for that, I will try to oblige them, but I'll try to educate them that there's far better ways to take care of their health. Yeah. And usually my first visit, I spend an hour or more. I want to get the whole ball of
Awesome.
wax, everything that's happened in their entire lifetime that's relevant to their health, and try to address everything. Because I find, to me, it's a game, almost like a puzzle, a 100-piece puzzle, whatever. When they tell me every little symptom they've had and this and that and the other throughout their lifespan, I want to put all those pieces on the table and see how they fit together and what picture they make. So the more data
Interesting.
points I can have,
Yeah.
the better I can
Yeah.
just determine what's going on with them.
Awesome.
Yeah. And I think one of the things that we've so appreciated about the practice also is just because of having your own children and raising 7 kids together and a whole slew of grandkids now. How many?
15.
Okay,
Ooh.
yeah.
Fun.
And having a family practice for so many years of your life, I think just the knowledge from, infant to adult and on through
Right,
life has just
right.
been so wonderful to have that wealth of knowledge and not have to go to a pediatrician or not have to go, to these different specialists for our
It's a
kids
family
and for everybody.
practice.
Yeah. Yeah. But it's not like just a vague, like broad family practice. It's like, the knowledge for
I
the
keep
kids and the babies is still there.
Envisioning Marcus Welby, MD. I don't know if you guys ever watched that show back in the day. He was just a hometown doctor that
Mhm.
saw the whole family and was
Yeah.
personally involved in their lives.
Yeah.
It's great.
Yeah.
So I think we're going to have to wrap this podcast up. We're going to
Yeah.
have these guys back again. This is too much fun.
Yeah, I just want to say, I hope that we can have them back sometime, and I hope that you'll tune in for that because we really want to touch on some hot topics, thyroid problems, thyroid and pregnancy
Yep.
specifically, some infertility issues. I know they have some really amazing infertility success stories, so we'd love to hear about those, and lots of more, tips from things that cross over from that toxicology and nutrition
Yes.
into pregnancy and how it affects those things. So we are out of time, but I hope that we can touch on those things in the future because they're really great.
Mhm.
So we thank you guys
Thank you so much.
for being
Oh,
here and
you're
sharing with
welcome.
us your life and your
Thanks for
wisdom.
the
And
opportunity.
I hope we can do it again sometime.
Yeah, it was a tease. I want more.
Yeah.
Well, that's it with today's part 2 episode with Dr. Mundall and his wife. Amazing stories. We've learned a lot together, and we hope to have you back again very soon. So thank you for joining us on More About Birth. We'll see you soon.
See you
Bye-bye.
later.